Hello, everyone. His patients include many international celebrities and many patients from the Middle East. My guest today is one of the most famous German American dentists in Beverly Hills, Joseph Goodman.
Hello, welcome to Beverly Hills.
From Germany to Beverly Hills, what's your story?
Well, I was born and raised in Germany, and I studied in Germany, and I came to America, and specifically Los Angeles, every year for vacation. And like many people, I got intrigued, Los Angeles, Hollywood, California, Rodeo Drive, the fancy, the big cars, the big high-rises, I like the lifestyle, the celebrities. So like many people, I was attracted and by this beautiful, California lifestyle and dream. So I decided to move about 22 years ago from Germany, Düsseldorf, Cologne, which is a beautiful city in Germany, to Beverly Hills, California.
What attracted you to dentistry? And can you tell us more about your practice?
Yeah. So what attracted me to this industry, you mean cosmetic dentistry, and is that you can really change somebody's life with doing cosmetic dentistry. It's unbelievable. We have patients come in, they're not happy, they're depressed, they're sad, they don't feel happy about themselves, they feel subconscious, they don't smile. They have a beard to cover their teeth. Now they're so happy with COVID because they say, I can wear a face mask, but that's not supposed to be like this. You're supposed to be free and happy and open and confident with yourself. So you can really change somebody's life. It's called a life makeover when you do a beautiful smile. Sometimes you don't need to do a whole smile makeover. Sometimes you can do 4 veneers, 6 veneers, 8 veneers. You can do minimal dentistry and you can achieve beautiful results. So what really interests me is that the fact you can make quick results, 1 week, sometimes a little bit less, and make big changes in people's life. That's what I really like about it.
Tell us more about your trip to Dubai.
Yes, so this all started when the ruling family of the United Arab Emirates came to my office in Beverly Hills, and they needed some dental work. They were recommended by Middle Eastern people. They said, Dr. Joseph is a very nice guy, come and see him. So they liked me, and I said, would you like to get started? And they said, it's my vacation time, now it's not a good time. Why don't you come to the United Arab Emirates, And I said, okay, I don't know how to get started. She says, don't worry, we take care of everything. So basically 6 months later, I was sitting in the airplane going to Al Ain, Abu Dhabi, Al Ain. They have a beautiful big clinic, big facility, and they asked me to bring my German equipment and medication. So everything was from Germany, where I'm from, of course. And I had the best office, the best staff, everything was ready for me, and I could do best dentistry. And I was sending my cases to Germany, actually, because Germany is closer to Dubai, of course, and Abu Dhabi. So I was mailing my lab cases to Germany. We waited a week, it came back, we cemented everything went perfect. So it was an amazing experience, Dubai and Abu Dhabi. And ever since then, I'm going back once a year.
What about your trip to Bahrain?
Oh, Bahrain was amazing. So when I was in Dubai, and I went to Dubai several times, I met people, like-minded people, dentists, people who lecture, people who have a clinic. And there was a group of dentists from Bahrain who met me and who said, we want you to come to Bahrain. I said, okay, sure, I come. So they met me in Dubai and Abu Dhabi when I was working there. And they reached out to me and they said there is a Bahrain Dental Association and they have a lecture and they want to have international people, dentists who lecture, and I was one of them, invite them and talk about cosmetic dentistry, celebrities, veneers, porcelain and all the different materials we have. So basically they invited me, I went to Bahrain, which was an amazing experience. A beautiful country, small country, but beautiful people, very nice.
How did you start treating patients in the Middle East?
So it's all started with, with one patient who came in many years ago. I think the first time was about 8 years ago. They came in, they had a good experience, they liked my personality. When you treat patients from the Middle East, it's more than just a dentistry. You have to be very good in dentistry. You have to use the best materials. They want to have the best equipment, but also it's a personality thing. You have to bond with them. You have to, accommodate them. So I started patients, back in 2012, 2013, and They liked me, they referred me a friend, another friend, another friend. And all of a sudden, a lot of people from places in America, they would fly in, people who maybe students, they study in a different state, they would fly in. And so we became more and more popular. So that's how it started, We attracted, a lot of Middle Eastern because of Beverly Hills, of course. A lot of people come here for vacation, they see us, they meet us. And I'm a very easy, accessible guy. So my cell phone number is on my website. People can call me directly or WhatsApp me. I can communicate with them. So I make it very easy to have a good relationship and to, be accessible.
What are the most popular procedures requested by your patient from the Middle East?
Yeah, the most popular procedures are porcelain veneers. So porcelain veneers are very thin laminates that you place on your teeth, and you can make a smile makeover. You can change somebody's smile completely. And they're very popular because everybody can do veneers, but not everybody can do them correctly. I have 10 commandments about cosmetic dentistry on my website. They cannot be too long, too big, too wide, too opaque. So there's a lot of details when it comes to cosmetic dentistry, and a lot of Middle Eastern appreciates those details. They want white teeth, of course, but they want to make sure they're not too thick, too heavy, too long. They look really nice and natural. So this is the most requested procedure in our office. Porcelain veneers, cosmetic dentistry, porcelain crowns, and Invisalign. We do a lot of Invisalign because you cannot be a good cosmetic dentist if you don't know how to do Invisalign, invisible braces, because everything goes hand in hand. Sometimes we do Invisalign for a few months to straighten the teeth, and then we do veneers. So you need to work hand in hand to make everything work.
What do you feel has been your biggest challenge today so far?
Yeah. When you have your own private practice, you always have to accommodate patients from all kinds of backgrounds. Some people have a good mood, some people have a bad mood, some people are, busy, some people are stressed. So it's very important as a dentist or doctor that you accommodate them and adapt yourself to them. I can tell in 3 seconds if a patient is friendly, maybe they're stressed, maybe they're busy, maybe they're not happy with themselves, and they reflect that energy, So it's always a challenge to make sure whether they're happy patients, they're laughing, they're smiling, or they're becoming a little bit difficult, that you always adapt and try to make this conversation about dentistry as comfortable as possible. So it's not easy. Everybody has a different story. Everybody has a different background. I think in America we say a different baggage. Everybody carries a different baggage. And it's important for me as a doctor or a dentist to accommodate them and calm them down and make sure they're comfortable, because not everybody is comfortable. And a lot of people are stressed. We just passed COVID, and a lot of people have anxieties, and they have a little bit of depression, and they have a little bit of uneasiness. And it's my job to make them comfortable and easy and relaxed. And that's my challenge for every patient, to come in to make sure they're comfortable.
What advice do you have to the upcoming generation of dentists who aspire to be successful like you?
I think the best advice is you always have to study more than the average. You have to learn more than the average. So if you go to school and they say you have to read 2 books about dentistry, about this chapter, you have to read 4 books. If they say go to 2 lectures to learn and come back, you have to go to 5 lectures. You always have to do more. You always have to put more energy to it. When I go home, I don't go home and watch TV. I go home and I study the cases I did that day. I review them. There's cases, for example, I sent to the lab with a fresh eye at night. I look at my iPad. I'm like, okay, let's make some changes here before we send the case to the lab. So you always have to improve. You always have to learn. You can never stop learning, and that's the goal in every profession, to become the master in your profession. You always have to learn. So even these days, I still go and read books. I read about different dentist development, new development, and new techniques. So I'm always up to date. So that's my best advice for everybody, to focus, study, and never stop studying.